name is Dr. John Mulima. I'm a chief medical specialist in obstetrics and gynecology. And as you are aware that this hospital opened its doors the first time in 1956. And for 70 years, we have never had any operations being done in this hospital. And now, Her Excellency the Governor, Mheshimiwa Susan Kihika, has made it possible now that we have a theatre in this hospital for doing serious and secondary other gynecological surgeries. And today I've done the first case myself here, and with Waziri and the other team. And we urge all the citizens of Nakuru County, and especially in this catchment area for Bondeni Hospital, that they can access care here, including surgeries here for maternity for free, as long as they register DARA and a SHA and the PSC fund at no cost to them. And as you are aware with the governor's manifesto, to upgrade our level force, to be proper level force in terms of services, and this is one of that initiative to make the proper level 4 by having surgeries being done here for those who need the surgeries. And we have started with the maternity cases, and we go to the gynae surgeries. So we urge those mothers who have been going to PGH in Nakuru, you don't have to go there for any maternity services, they just come here to Bondeni. And you want again to cascade this to other level 4 hospitals in the same catchment area, including Rangaranga, to have a maternity theatre as well. So we are very thankful to Her Excellency the Governor for making that one happen, and we got to move forward, and we have the others with the same services. And our surgery has been very successful. I think you have seen the mother, her baby. They are both okay, and we are now waiting for more cases to be brought here. So we are living here at night. We don't want to leave any mother here not done surgery who requires the surgery. So that has been made very clear. It's not ceremonial for today. You come today at night, you come tomorrow, any other day from now moving forward, you are going to be doing surgeries here 24/7. Now let me welcome Waziri to say something.
Thank you very much, Dr. Mine is first of all to thank the team that has worked around the clock to ensure that this vision that Her Excellency the Governor had to open this theatre is done today. And that would not have been made possible without the management of this hospital, so Dr. Ator, but also the specialists, the anesthetists, the nurse managers and the nurses, and the entire team. We, at the beginning of the year, deployed 2 medical officers to this facility. One of them was actually the assisting surgeon here. She's called Dr. Bahati. She'll be based here. She'll be domiciled here. We also have an anesthetist, I think he's here, Dr. Serem. So the point is, we want to make sure that the capability of this low volume level 4 hospitals grows. And as we expand service delivery options and units, we decongest our Nakuru County Referral and Teaching Hospital. So like Dr. Murema has said, let us encourage our communities to develop confidence. These are qualified specialists, qualified medics who are here to offer support to them. We'll continue to advance these service delivery enhancements across all our 15 level 4 hospitals. And as we move towards building the governor's, delivering the governor's promise to make sure that every sub-county hospital has got a fully functional, optimal level 4 hospital. This will begin to cascade to the other 11 sub-counties. So I thank you all very much.
Waziri, would you mind sharing to us the amount of money that has been used to set up this maternity theatre?
Okay, so it's been a long, progressive process. I'll ask Dr. Morema to handle that one.
As you are aware, this theatre was done some years back, was abandoned. So we have just innovated it and we have equipped it. Maybe it should be about, maybe equipping it has been like 7 million. That's buying the equipment and the instrument that we need. And the gear that you see us even wearing, the scrubs. And as you can see behind yourself, because you have done the repainting and all that. But that's just an estimate that we have done. But I wish you were medics to see the state of the art of the inside yourself.
Earlier on, talking to the medical superintendent, she said that there are those cases that might develop some piece of compound breathing or something that be taken to refer to the PGH. What don't you see that one will be a challenge a little bit when it comes to transportation of these children to up there? Do you have any plan to have your own independent unit that can take care of that?
Maybe that's a newborn unit, but we have a small holding area for that. But like any other case, we have a referral system. So I don't think it's a major hurdle for that. And as you are aware, even the surgery can also be complicated by whatever reason. So again, we also have a referral mechanism that happens across the county, and even at our own referral hospitals refer to KNH and even more referral. So it all depends on the case by case. But ordinarily, maternity cases, we hardly refer some of these cases. But when they do, then we are able to address that. But there is no single facility that can be in-house 100%. Yeah.
That's the last question. How many maternity cases does this hospital handle? And by opening this theatre, how does it help Nakuru County with the burden of maternity care?
Okay, so Dr. Etaro will handle that one.
Good afternoon, everyone. We are currently doing an average of 100 deliveries in a month, and we do referrals to PGH, 50 referrals to PGH, which is our bigger level 5 hospital. So by opening this theatre, we are going to decongest PGH, and as our mothers will be able to access comprehensive services in our facility.
In the case, as you get as of deliveries, we are going to add more staff to the facility. But you have to start from the point.
So currently, how many staff do you have here?
What's the number of staff?
Just for the theatre, that
Oh,
12. Yes.
and we expect the number to
To go up,
as the
yes.
workload grows.
Yes.
We work in shifts. So as we have more work, we keep on working the shifts. But for now, so far, so good.
So those that will be operating here will just be resident?
Yes.
Not being called from?
No. The doctors who are here, they are here to stay.
Same case with the nurse. Yeah.
So after this information has gone out, you expected that there will be a lot of people coming here. How are you prepared to handle the number of patients that will be visiting you?
You see, the workload, that's what we call a workload. And so it is usually cannot be an overnight thing. But as the workload is going to increase, we're also going to increase the staffing levels. So the staffing levels in terms of additions will be guided by the increase of the workload. Yes.
There's one more thing that I think is important for us to mention. As you know, Dr. Morema said he's a specialist obstetrician gynecologist, but he's also a chief officer medical services with a full-time job. We introduced mechanism in the Department of Health where all the clinical team members who are in management are required to practice their trade. Dr. Morema has shown that. He has exemplified that. And in fact, for this hospital to partially answer your question, we have received a lot of support from all the other doctors with his skill to come and support the doctors, Dr. Bahati, here for the next 1 month. That way, as the workload grows, we also have the support of the bigger hospitals in terms of the specialists, and then we can stabilize the hospital that way. So I truly want to thank Dr. Morema for stepping out of his role, and for all our other med soups and specialists who are going to do the same in coming days. I want to thank them in advance. Thank you.
Those are hasn't training, surgical training for
Safe surgery.
maternal unit, yes. Would you say that those skills that were undergone have been used today? Is it something that we are going to continue seeing?
So in fact, that process, I want Dr. Susan. She's here. Molo is one of the facilities that has benefited from that. She's Dr. Susan. She's a med soup Molo Sub-County Hospital. So that training was not just, it's for obstetric safe surgery. It's really to improve the capability in theatre. But it was not only for PGH. It was for Molo, Bahati, Gilgil, and a few others. We have discussed with our partners, Jipaigo, and now Dell Foundation is coming on board. And yesterday, actually, we discussed this particular theatre, Elbagon, Annex, and one other, Olinguruani, so they can expand the scope of that training. But remember, the people who benefited from that training become master trainers. So they'll also be coming down to cascade the skill, and Dr. Susan can confirm.
Yes, thank you so much. Molo Sub-County Hospitals is one of the beneficiaries of that training, and we have seen significant improvement in the number of surgical site infections, because one of our specialists is trained and a medical officer plus other nurses, and we anticipate that Dr. Yator will borrow them for a few days to come, and even if it's not a proper training, an OJT training, so that we can cascade the training down even before the county sets up a proper training, that we can mentor them as a start. Yes, but it has been helpful to our hospital. Thank you.